Good day everyone, I am Carla Jane Ceballos, and for today I will going to discuss about the steps on doing the internal examination. So first, before tayo proceed sa steps, ay sa define sa internal examination. So ang internal examination is a procedure involves the caregiver putting on a sterile glove and often using an aseptic cream applied to the first and second fingertips. So their two fingers are then gently inserted into the woman's vagina so the midwife or doctor or caregiver can examine her cervix. So ang pag-IE mo na examine sa cervix sa mother kung pila na ka-centimeter ang baby. So ito sa first step on doing the internal examination. So first step is prepare the articles completely. So prepare nimo ang mga kinahanglan nun, especially the instruments. Dapat nga na siya, ready na siya. So next is explain to the woman what are you going to do. So second is imo i-explain sa mother kung unsa ang imong buhatan niya kay para di siya makurat or makaibaw siya sa imong buhatan as a midwife or doctor. So third is put the mother in a dorsal recumbent position. So imong ibutang ang mother sa dorsal recumbent position. So next is take full aseptic precaution. So dapat mag-practice ka nga i-prevent ang mga contamination nga pwede nimong mahatag sa mother. So dapat hinlo ka kanunay. So next is rinse the vulva with clean water. So hinluan nimo ang vulva o clean water. So next is wash hands dry. So i-wash imong hands and then imong paughon. So ka-7 is put on sterile gloves. So di ka man imong pangunaw, imong i-dry imong hands and then imong put na kag sterile gloves. So sterile gloves jud imong gamitan basta mag-IE ka. So inspect the vulva. So imong inspect ang vulva sa mother kung hinlo na ba siya, kung okay na ba siya ihon. So next is there amniotic fluid? Is it clear o meconium stain? So inig-inspect na mo sa vulva sa mother, imo tanawon if hingbuto na ba ang amniotic fluid or na pa ba ang amniotic fluid. Kung hingbuto na, clear ba siya or meconium stain. So ika-10 is there any abnormal discharges, blood or pus? So imong tanawon sa vulva sa mother kung nabay any abnormalities, discharges, like dugo ba siya, nabay dugo or pus, meaning pus kanang nagnana na ang vulva sa mother. So next is apply sterile water soluble lubricating jelly into the second index and the third middle finger of the examining hand. So kung mao ni imong examining hand, ang imong second og ang kanang third nimo kani og kani, imo nang butangan og lubricating jelly or KY jelly. Sunod, ready your lubricated hand for the insertion ko. Butangan na nimo ni og lubricating jelly. Ihanda na nimo para sa mag-insert na ka, mag-IE na kagsugod. Next is separate the labia with the thumb and little finger of the right hand. So for example, mana yang ang vulva sa mother, ang perineum sa mother. So imong thumb og imong pika sa kani, mo open or imong ihiwalay ang duha ka labia. So next is insert the middle and index fingers carefully into the vaginal OS up to the cervix, gradually rotating the hand in the process until the palm faces upward and the fingers come in contact with the cervix. So, diba nakasad naman ka? So, hinay-hinay, imong i-rotate imong fingers para upward para until nga makontak na sila sa cervix. So, ma-rotate na nimo may mo nang mahawidan ang cervix or nanabayos sa bata or waka or mahibawaan nimo na pila na ka cm. So next is reinforce the instructions on the relaxation technique. So imong reinforce ang mga instructions on the relaxation technique. So next is the thumb rests on the symphysis pubis externally and the fourth and fifth fingers are kept flexed, not in the contact with the anus. So ang thumb rests gyapon siya sa symphysis pubis externally and the fourth and the fifth fingers keep flexed. So kani fourth o fifth ga-flex gyapon na siya para ang fourth o fifth flex gyapon na siya and not in contact with the anus. So next is note the following during internal examination. So another mga dapat inote mo while you're doing the internal examination. So first is condition the cervix. So first na mo inote is ang condition the cervix, kung hard ba siya, soft, close, or open. So cervical dilatation or CM to assist the cervical dilatation. Insert the middle and the index finger into the open cervix and gently open them to the cervical rim. So imong hinahinayan og insert ang imong middle og index finger into the open cervix para gently imong i-open na sila para modo na sa cervical rim. The distance between the outer rim of the both fingers is the cervical dilatation. The approximate diameter of the cervical opening in centimeters is estimated using these fingers. So, cervical effacement. So, kung ingon tag cervical effacement, mao na ang kabag-on sa cervix sa mother. For example, cervix is not effaced or dilated. So, close pa ang cervix sa mother ana. Kung ingon pa tag cervix is 50% effaced and not dilated. So, 50% na open na gamay siya, pero gamay siya ka 50% pa man. Kung ingon kag cervix is 100% effaced and dilated to 3 cm. So, open na siya, mga ingana na siya, open na siya. Nanay space gamay. So, kung ingon tag cervix is fully dilated to 10 cm mo nang open na kayo ang cervix sa mother, ready na siya for delivery. So next nga imong inote while doing the internal examination is the presentation of the fetus. Kung breech ba, cephalic, shoulder, or others. Meaning ang breech, ang tail ang naguna. So ang cephalic o ang naguna, shoulder, or other. So next nimo inote is the position. Kung LOA ba, LOP, right OA, or ROP. So meaning, ang LOA, the left occiput anterior. Muna sa ang pinaka-common sa labor. So, in this position, the baby's head is slightly off center in the pelvis with the back of the head toward the mother's left thigh. So, muna ang left occiput anterior or LOA. Kung may patag LOP, muna ang the baby is facing forward and slightly to the left or looking toward the mother's right thigh. So, mo na LOP. So, kung ingon pa tag ROA, in this position, the baby's head is slightly off center in the pelvis with the back of the head toward the mother's left thigh. So, ang ROP, mo ang baby is head down and the back is to the right side. This position can be deceptively reassuring. ROP is the most common and the for posterior position. So, mo na siya. So, next is the station. Kung may station, as you go through the labor, your doctor will use different terms to describe how your baby is progressing through the birth canal. One of these words is your baby's station. So, meaning, fetal station describes how far down your baby's head as descendant into your pelvis. So, unsa na ka layo So, kung kuan ba siya, negative 3, negative 2, negative 1, or plus, or positive 1, positive 2, or positive 3. So, next note is the condition of the bag of the water or membranes. Intact ba siya or rupture na siya? Kung rupture na, dapat mo pong inote ang characteristic sa amniotic fluid. So, next is pelvic arch or architecture. Or scalp spine ba, prominent ba, or not prominent. So, next nimo inote is the diagonal conjugate. Kung ingon tag diagonal conjugate, mao na ang distance from the undersurface of the pubic arch to the sacral promontory. So, dapat inote mo kung 11.5 cm less than or 11.5 greater than. So, lastly nga imong inote while doing the internal examination is to assess the vagina or perineum. Imong i-assess mo ang vagina or perineum sa mother. Kung firm pa ba siya or gahi pa siya or distensible. Distensible meaning able to stretch and expand. Kung okay na ba, kung gahi pa ba siya, kung firm, gahi pa, or kung yung tag distensible mo na okay na ba siya or mo stretch pa ba siya or mo expand. So, mo to siya ang dapat imong i-note. So, that's all. Mo to ang steps on doing the internal examination. Hinaut nga namoy na nahibaw-an. Thank you.